Hello, my name is Dr. Ron Warner. This is continuing the series of talking back from Aligned Care Chiropractic. Today, I have three questions that I'm going to attempt to answer. Within there, the first one is when I stand in front of the patient, what is it that I'm studying within their posture? What am I looking for? The second one is how am I different from other chiropractors? They gave me 4 words to describe that, so that may be interesting. But I'm actually going to use it to play into the other two questions. And then the third one is explain the gravity and treatment interaction. So within that, to start out, 4 words I would use to explain how I'm different from other chiropractors. That would be crack, cervical, posture, and then anatometer or PMD. So the very first one, crack. How does that come into play? I don't twist or crack or snap anything to realign the body. Within there, it's a very gentle alignment, and that plays into the second part, the cervical area. So I adjust in the cervical area. In the cervical area, I use my hand though. Within other practitioners that adjust in the cervical area, some use an instrument, and some of those that don't crack or snap also use an instrument. So within there, I'm very unique because I use my hand and I work in the upper cervical area to actually realign the spine. And so that plays into the other question of, let me see, explain how gravity gravity works with the treatment. So when I adjust in the cervical area, I'm actually, the body senses through proprioception, through different sensors in the body. And the way I explain that is if I push on your shoulder, you don't fall over. And that is the body actually, the cerebellum actually picking up the force, and it causes postural muscles to contract and resist against that force. So within there, when I actually touch the side of your neck, I'm actually touching specific locations to release these tension lines that are actually holding the body in a misaligned state. And so within that, when you break those lines, it actually causes the body to actually recalibrate through proprioception, through the sensory information. So when you stand up after the adjustment, gravity comes into play. And there's a recalibration of the gravitational forces through this sensory information, and the brain forms a new picture of where you are against gravity. So that explains the gravity interaction with treatment. Posture, how posture comes into play and how I'm different is I actually analyze your posture to determine how to adjust you. We're always taught that posture is how you sit or stand, but I always say it's so much more than that. It's actually a physical representation of where your body perceives gravity is in play against your body. So within that, the posture, how I evaluate that, it plays directly into how I adjust each patient individually, and it could be time to time. And so that plays into what I'm looking at when you're standing on the anatometer or the posture measuring device. So I look at these are all compensations the body's making against gravity to hold you up straight against gravity the best it can, depending on the injuries, accidents, trauma you've had, or it could even be a natural neurological breakdown. So I look at head tilt. I look at your neck tilt, and these are all based against a grid that I have behind my patients. I look at your shoulders, which one's lower, which one's higher. I look at your hips as far as which hip side is higher or lower. And that the hips and the shoulders actually show me the compression. And within these, the posture, when I evaluate, is a reflection of where your spine is at, how it's twisted and rotated and bent over. And that plays into the last point of the anatometer or the PMD. The anatometer is the device I use to collect digital data on each patient before the adjustment and after the adjustment. And this is something that no other technique does, is actually evaluates the patient before and after the adjustment every appointment. And so what I'm looking for is when you come in for your consecutive appointments, I'm looking to see how your body responded between the appointments. So what you show up as, I look at that, I annotate all that information down, then I adjust you. And after I adjust you, I'm looking for a very specific position that I want the body to be in. An up and open position, which I know is a healing position. So when the patient leaves, their body is in healing state. And then when they come back, again, once I see where they come back in, what kind of a state the posture's in when they come back. So I hope that answered those questions fairly well. And as always, if you have any questions, please contact us at Align Care Chiropractic, 269-366-4146, and be happy to answer those. And this is just another portion of our Talking Back series. Thank you very much, and I hope you have a wonderful day.